I've had back pain for a long time. The left side was much worse. I had leg pain, weakness, as well as the back pain. The pain pills just didn't take care of it. Finally, the doctor ordered an MRI, and it showed I had a herniated disc. By the time I got to the neurosurgeon, it was actually starting to get a little better. So we elected to just wait and see. If it came back, I was supposed to call him back, but he left town. So I just went back to my family doctor, and she just wanted me to take the muscle relaxers and the Tylenol or Advil. That just didn't do it. I had horrendous, shocking pains in my back. I was getting to where I had a limp. A friend of ours had been here and seen Dr. Lohr, had great success. He thought that I ought to come here, at least get my consultation and have him look at my MRI and see if he could help me. And I did. I started treatments that day, and it took about 4 weeks for me to really get rid of those shocking pains, and now it's gone. I wasn't able to stand for very long, and I can stand for 2 or 3 hours now. I can get down on the floor and play with the grandkids, play with the animals, It's better. Back to enjoying my retirement again. That wasn't a good way to start retirement. But he took one look at the MRI and knew that he could help me. I think some of it had to do with the vitamins, the orthotics, not going to my exercise class, not walking for a while. I had to totally take it easy, which I wasn't used to doing. I was used to being on the go constantly. So once I reduced my go and took it easy, sat in my chair, watched some TV, did my ice packs, it was much better. Much better. And now I haven't had a treatment for a month, but I don't hurt anymore. Not at all. I can't believe it. I used to work for a neurosurgeon. I know the other side of it. To know that you have this option is great. Surgery is not always the answer. The friend that recommended it had surgery and didn't get really good results, or there were some complications. So he came here, and I guess it took Dr. Lohr a little while to figure out what was wrong and how to treat him. But he's wonderful now, as happy as I am, I think. I can't say enough good about this place. It really helped a lot. And it's not like any other doctor's office. You very seldom have to wait. Their scheduling is so that you walk in and they're almost ready for you at the time you walk in the door. But you walk in the door and you fill out your paperwork with any new information, injuries, whatever, any other symptoms, so that Dr. Lohr knows that. And they take you right over and get you going. And the treatments, you don't know that they're pulling you. In fact, a lot of times I went to sleep. Dr. Lohr would come to talk to me several times, and I jumped because he startled me. I was asleep. But he talks to you almost every time you're here. He remembers things about you. And did you go here? Did you go there? He's a wonderful guy, very knowledgeable, and really helps. One thing that they do, the first time you're on the table, Shelley will go over and explain every move to you. You know exactly what they're going to do before they do it, or while they're doing it. You know what to expect. And I think that helped a lot too, because this I didn't know anything about. And they talked to you about the vitamins. They fitted you for the orthotics, and I think the orthotics is one thing that maybe made a big difference for me. Made me walk evenly. It was a good thing. This was a nice option. I was dreading having to go through surgery. I know a lot of people have scar tissue and they have other complications, and I didn't want that. So if I never have to go through that, that would be great. I think he's helping a lot of people. They just need to come in and try it. have their consultation, let him look at their films, see if he can help you, set up the treatment plan, go through it. If it doesn't work, well, you've tried. I was kind of skeptical in the beginning, but I was hurting bad enough I wanted to give it a try. And insurance doesn't pay for it, but I did it anyway. And I'm glad I did. I'm back to walking. I'm back to my exercise class. I'm back to doing a lot of things that I missed, but I don't hurt anymore.